Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Today is Tuesday, July 5th. I think I got it right, 2022. So I'm on a good 2-week track with keeping the date right. As you see, we are remote today, away practicing some self-care and getting some sun and some water. But it does not take away from the fact that we're still here with you for your Healthy Java every first and third Tuesday to discuss health, sponsored by the Massachusetts General Hospital, Office of Equity and Community Health. Before we get started, and I'm going to bring our guest into the room, but before we get started with our topic about updates for the pediatric vaccine and also monkeypox, I'm going to bring Dr. Sanchez in because once again, in this country, we have had a tragedy of a mass shooting. And so we would just like to name that and also send thoughts and prayers. And I know to a lot that seems like a cliche. We need legislation and we need policy at the federal level, but we just wanted to hold space and acknowledge those 6 lives that were lost there in the suburb of Chicago. Dr. Sanchez, I hate to start out with such a real but gloomy topic with all that's going on, and we'll talk more about self-care at the end of the show. But Dr. Sanchez, just wanted to give you space to say anything that you would like to say, and then we'll jump in on our subjects. But good morning. Good to have you here again.
Good morning, and thank you for having me. And just really highlight, that these acts of violence really are devastating, and that violence is really a public health crisis. And we really urge everyone to take care of themselves and seek whatever support they need to really process these events. And our hearts go out to those victims and their families as well.
Dr. Sanchez, thank you so much. And as I am on the road and people know that I'm 100% real, I'm just going to go in and switch over to our proper branding for your Healthy Java. I just looked. But Dr. Sanchez, we're here today to talk about there is still something else, all that's going on in our world and community. And there's still COVID-19. Numbers are fluctuating. We're in the summer and everything that we've experienced for the past 2 years with that. But fortunately, there's an update to the pediatric vaccine.
Yes.
And what's that update? Please, Phil, because I don't want to mess it up.
So vaccines are now available for young children and babies and children from 6 months and older, which is incredibly exciting. I think many parents have long awaited being able to vaccinate their babies and protect them from COVID. And so now vaccines are available from the 6 month to 4 year age group. So now any child 6 months and older, anyone really can get vaccinated against COVID.
Great. And with that, I know, earlier with the vaccine, not only for us as adults, but a lot of parents had concerns about their children, whether it was enough research done and things like that. From your findings and awareness, there has been research in this space where parents can feel confident about getting the vaccine for their children. Is that correct?
There is. And, we first want to highlight that every parent, of course, wants what's best for their child. And so, these can be very hard decisions, and just acknowledging that is important. We do have a long history from many vaccines to sort of, that we really draw on to highlight the safety of vaccines for children and adults generally. And we've also seen that millions of children 5 years and older have already received the vaccine very safely, as well as adults. And so I think we really can draw on that to feel confident recommending the COVID-19 vaccines for our young babies.
Thank you for that. And Dr. Sanchez, I know even with us, I'll say older, more seasoned folks, there was the number one concern about side effects. And so no vaccine, no medicine, if I'm correct, not a physician, does not come with some sort of side effect or an issue because our bodies are individuals. And so one of the questions, and we usually take questions at the end, but Brother Cliff will let him ask that. Are there any recorded side effects for children?
So some of the more common side, and you're right, you're completely right. Every medication, every procedure does come with potential side effects, and that we need to be mindful of. Vaccines, the most common ones have been relatively mild, and those are a sore arm, sort of pain at the site. Some children can have a fever, and muscle aches, and those usually go away within a few days, like 1 or 2 days. There is sort of another rarer side effect, but still acknowledged, which is the inflammation around the heart, and that's called myocarditis or pericarditis, and that's been seen mostly in adolescents, sort of older children, sort of the 12-year-old, 12 to 30-year-old, actually, sort of younger adults. And that being said, it has been also a fairly self-limiting disease, meaning it's pretty mild, and people do very well. And so I think, those are some of the more common side effects, again, that one particularly with these vaccines, and then fever, sore arm that we see with all vaccines. And I think an important piece is that we always weigh what those side effects are against the risk of getting the disease. And we know that children and babies, while it can be rare, some of them do get very sick. And so that protection that is offered by the vaccine is so important.
And one of the things that has been said throughout when the vaccine was made available is that, and Dr. Labre has said this on here plenty of times, that, and other doctors have too, that the benefits do outweigh the risk as far as trying to decrease the spread of COVID-19. Kind of off the cuff question, as I just thought about, but you're a public health official, so there's this notion that COVID is going to be with us always, and it may start, we may, interact with COVID similar to like the flu. From your perspective, research, is this something that we're just going to, is it going to be an ongoing public health issue? Let me frame it like that.
It's very possible. We're still learning more, but it is very possible. It's been with us now for almost 3 years. So that's certainly possible. And, again, we see cases, while our cases are low, they're still here, and we can expect them to go up in the winter. So I'd say yes. And I think that's why it's so critical for our families to get vaccinated. Even if you've been infected with COVID-19, the protection that you get from the vaccine is so much more critical. It really boosts your protection. And so, the COVID is still around, and we might, we might get exposed in the future because COVID is really still around. So it really highlights how important it is to get vaccinated, because the protection is so important. It adds so much more protection than just natural infection, especially as we potentially face future waves.
And that's one of the things that's interesting, because I've heard that, that there might be another wave, coming in the fall. And then thank goodness, I don't know if this is full wood, but we haven't heard too many of the V words lately. We've last left off with Omicron, Deltacron, and so now it's NBA, well, not NBA, but NB5. And so we haven't heard a lot about new strains. Is that because we're not in the public health spectrum, or are we kind of getting okay with it mutating?
We are still looking very closely at variants, at particularly, so they are still, there are still variants emerging, and those are being sort of very closely studied. I will say, I think a critical piece is that, we have seen deaths and hospitalizations come down. I think that is, and that might be sort of a reason why news is not as news have, shifted a little bit away from COVID. And I think it's also a silent reminder of how much vaccines have really helped us get to where we are, where COVID might not be as much part of the national news as before, because we don't see as many hospitalizations and deaths. But as you said, we definitely can expect both flu and COVID cases potentially to come up in the winter, which is why it's so important to get vaccinated against both. I always make a plug for flu whenever I can. So
I was literally I was literally just getting ready to say that, it may behoove us to get in, and I'll be honest, because right now as adults, we get the first vaccine, the second vaccine, the booster, and then those that are 50 and up or have compromised immune systems or other health complications are eligible for the second booster. Children ages 5 through 12 can get that. Now, I'm not versed on the adolescents. It's 1 shot, 2 shots, and then are the adolescents getting a booster as well?
Yes. So actually, anyone age 5+ is eligible for a booster.
Okay.
So if you're five and older, you're eligible for at least a first booster. And then if you're, as you mentioned, if you're 50 or older or have certain medical conditions, or if you receive J&J and you're eligible for a second booster. Yes.
Okay. And we're going to get to questions in just a few moments, folks, because I see them there. The other piece I wanted to ask about is the 6 month through 5. Is that 2 shots right now without a booster?
So that is currently, it depends on the vaccine. Moderna is currently 2 shots, and Pfizer is 3.
Okay. And Johnson & Johnson would not be available. Moderna and Pfizer were the only 2 that did the 6 month through 5-year-old. Okay.
Yes.
Thank you for that. Dr. Sanchez, one other thing, and I saw you on the news a few weeks ago and kind of sat back and smiled and said, oh, she's been in the Java Cafe before. But you were at MGH in the onset of what we currently are calling monkeypox. And if I could ask you, if you can just give us a little, overview of what monkeypox is.
Sure. So monkeypox is a viral illness. It's been fairly rare in the past, and it typically causes, a flu-like illness with a rash. And the rash is kind of the hallmark. The rash is pretty similar to sort of chickenpox, where, it's like fluid-filled sores or pimples, and they can be all over your body. And it's been typically rare. We've only seen it in certain parts of the world, typically Central Western Africa, and sort of small outbreaks associated with travel or other epidemiological risk factors. And now we're seeing a global outbreak. We've been tracking one since May. We're up to greater than 5,000 cases in the world and 460 cases in the United States, and up to 21 cases in Massachusetts.
Can I ask you, in perspective, and a lot, they're coming off of COVID, people hear about another disease, another communal, what's the proper term, Dr. Sanchez? Communal disease? Is that the proper term?
Well, it's being seen in the community, yes.
Okay. And so folks are hearing about it, and they, coming off COVID, folks got concerned. This spread, the way that it spreads and the amount or the level at which it's spreading is not the same as COVID. Is that correct?
That's true. It spreads in a different way. So this virus is actually, it's harder for it to spread, and it typically spreads through very close skin to skin contact. That's the most common way it actually can spread, like through the sores that I mentioned. So touching those sores or being in skin to skin contact with sores, which can be sometimes hard to spot. And they can even be present in tricky areas around, the genital area. So we've seen it spread through sexual contact, through skin contact. Other intimate contact can also spread through bedding and sort of contact with objects that have been touched some of the sores, and very less commonly through respiratory droplets. But that's much less common. We actually haven't seen sort of that type of spread thus far in the current cases.
And we wanted to name, and also because I'm aware, and it's been stated on the news, I've unfortunately seen some memes on social media about monkeypox. And I'll ask you as a medical physician, currently those cases that are across the world or in the country in Massachusetts, the majority of those that are presenting have been homosexual men. Is that correct?
Yes, most cases in the current outbreak have been seen among men who have sex with men through social networks.
And thank you for that. And I just wanted to name that it just, because we, pre-talked about the fact that we don't, as much as possible with any type of disease or anyone dealing with sickness, including mental illness and things like that, that we don't want to get into a thing of marginalization and stereotyping. That is a fact that's part of this particular disease. But you express in our pre-convo just that we don't want to not marginalize. What's the proper word, Dr. Sanchez?
we don't want to stigmatize. I think that's an area, that's something for the commission that's just really important. Monkeypox is not a gay disease. Anyone can get monkeypox.
Say it again, please, for the people in the back. Can you hold on? I'm gonna put you on full screen. Say it again, please.
Monkeypox is not a gay disease. Anyone can get or spread monkeypox. In many ways, part of what you might be seeing it, why we've been detecting it amongst men who have sex with men is because many of them actually do seek very regular care and likely have been, we've diagnosed more cases, but anyone can really get it. We really, there might be many undetected cases, there might be undetected cases as well. But again, anyone can get it. And it's really important that we do not stigmatize, but rather educate. And really, spread awareness of the disease. And, we're all in this together as we were in COVID, as we've been in COVID.
Absolutely. Thank you, Dr. Sanchez, for that. And I know we usually take questions at the end, but if you don't mind, we're kind of off the cuff today, and I'm not going to keep Dr. Sanchez for the whole hour. One question specifically to monkeypox is, can you get it in the mouth?
Yes, you can. You can get the sores on any part of your body, and so you can get it in the mouth. You can get it across your arms or legs, and you can also get it, in genital areas. So you can really get it anywhere.
Thank you for that. And one question, if you don't mind, going back to the vaccine, and this is we've been intentional in trying to give some historical context to the concept of vaccine. But can you give us about a 45-second overview of where the vaccines come from in general? And though I'm not a doctor, Pastor Marion, I know the companies they're coming from are Moderna, Johnson & Johnson, and Pfizer. But just a general, Dr. Sanchez, of where vaccines come from, the science or knowledge behind it.
Sure. So I think vaccines come from us really studying how to build immunity against viruses. And typically that is by often showing a piece sort of that's a piece that's very similar to the virus, like a protein to the body, and mounting an immune response. And that's really the principle behind vaccines, is to trick it into sort of developing immunity so that when you're actually exposed to the virus, your body is ready. Your immune system is ready to fight it. And so those are some of the principles. The current vaccines, and I want to highlight, they are not live vaccines. They do not contain the COVID virus, and they will not give you COVID. However, they have parts that, proteins that will induce an immune response and have your body prepare to fight COVID once you are exposed.
And the COVID-19 vaccine is no different from the vaccines that we are required to take to work in medicine. Vaccines were required to take to be in educational systems. And so we just wanted to name that again. Thank you for that. And Pastor Marion, thank you for the question. So thank you so much for mentioning the updates about the pediatric vaccine and also monkeypox. One other question, Dr. Sanchez, before I let you go. And again, this just sort of hit me, but from a public health standpoint, we talked about what's going on with violence. And then also a national issue is the importance of proper availability of reproductive health for all women, trans women. And so I could not have you, I just thought about it, and so forgive me, but I could not have you on the screen and ask you just to talk about the importance of the availability of reproductive health for women, trans women, all of those that would move in a space of needing that type of healthcare.
I mean, it is absolutely critical. We have the Boston Public Health Commission, myself. I mean, we believe in reproductive health care for all. We advocate for it. It is really tantamount to sort of proper maternal health, proper just general health, comprehensive health. So I really could not emphasize more how critical reproductive care is to us, and that we really are advocating very strongly for our communities, and for our own residents as well.
Thank you. And there's a little bit of conversation, Dr. Sanchez, if you don't mind. Viewer Belinda is referencing to this presumption that HIV was a gay disease, and also Heidi Ivy is asking, we don't talk about HIV and AIDS as much anymore. Where are we with it? I will say this one thing, and I remember Dr. Fauci mentioned it. A lot of the science, if I'm correct, some of the science behind the creation of the COVID-19 vaccine, was it built a little bit from the knowledge of the HIV HIV treatments or things like PrEP? Or, and maybe I'll shut up because I think I'm getting a little too deep and I'm not a physician. Go ahead, Dr. Sanchez. Where are we with HIV and AIDS?
No, I mean, I think, I'm a lot of my, us in the infectious disease community, I think we've been very much reminded of the onset of the HIV epidemic, especially as, with sort of the monkeypox response and so monkeypox virus response. And so I think it's, again, really highlighted for us the importance of advocating for a non-stigmatizing response, from government officials, from organizations, from everyone, really. And so I think, and really trying to make sure that we educate and provide early, timely information to help people to, make decisions to protect themselves. I think it's really important. With HIV, I think one of the critical things is we have treatments, and many people are virally suppressed and are able to lead full, healthy lives. So again, I think it really is a testament to science and how, and again, to us as a society in terms of how far we've come. And I will say, I think what you mentioned about vaccines, we've been studying many treatments against viruses, cancers for years for some of these mRNA vaccines. And so again, that's why they were studied. And really, that was the prep work that went into, the COVID pandemic. We already had years of research to build upon for these vaccines.
Dr. Sanchez, thank you. If anyone has any other questions, please let us know. We're going to get ready to wrap up. Sort of an abbreviated session today, and I won't blame Dr. Sanchez. It's because I'm away. She dedicated the hour with us. But one other thing I would like to ask you about, because I know the commission is aware that we're in the summer. And is there anything that you were promoting around summer safety, either to parents or to children? I'm not familiar with the current temperature there in Boston, but it looks a little heat wave-ish down here. But what are some of the summer safety things that the commission is encouraging residents to practice?
Sure. So I think, heat safety is certainly one of them. So being mindful of, the need to either, be indoors or sort of mist, depending on sort of the weather, to have access to water and proper hydration and sunscreen to protect your skin. The other piece I'll mention in infectious disease is mosquito safety. So making sure that when you're outside, particularly at night, which is when those mosquitoes can come, that you use repellent, and that again, you clean up standing water around the house, because that can really attract mosquitoes. And, all the other pieces that we've mentioned, being up to date with your vaccines with your whole family before the school year starts, so that we can have a healthy school year. It sounds far away, but, the summer, it can go really quickly. And so it's really important to just, be up to date with your vaccines generally. So those are, and then, making sure that with barbecues that you cook food safely. That's another one that we often.
Food safety.
Food safety.
And also, before you cook it, don't leave it in the shopping bag for 2 hours before you put it on the grill without it being properly chilled. Yes. Is that part of it as too? Because we have foodborne pathogens. I'm sorry. Go ahead.
No. I mean, it's all about making sure that food is properly stored and then properly cooked. I mean, really all that I mentioned, is really prevention, right? And these are all of it's a focus on disease prevention and all the things that we can do to keep ourselves safe and healthy. That's really what's really critical for the summer, to have a safe and healthy summer.
But Dr. Well, maybe we'll go a few more minutes, but not till 10. But I love how you said that all that you've mentioned this morning is about prevention. And that made me think of the fact that we talked about health disparities and social determinants of health. And so Dr. Alabre has said this before, that we've been so much times as people of color, we've been sometimes behind the curve of awareness and accessibility. So if you don't mind, can you just reiterate that summer safety, the vaccine, proper food, it's all prevention, but why the focus on prevention?
Well, I think that prevention is really what keeps us safe and, really avoids, I think it's critical, right? I mean, we in health, we in medicine, I think are always thinking about prevention. And I think that for the past 2 years, obviously we've been in a pandemic that's required an ongoing response, but now we have technologies and ways to protect ourselves, right? And I think, and to prevent disease. And, I think globally speaking, it's a reminder, at least for me as an infectious disease doc, there are many things, small things that we can do to prevent disease. And that includes, washing your hands,
So we
towards the
just
winter, or when you're
somebody
sick,
put
wearing
that.
a mask or staying home, cooking food well, wearing condoms and having safe sex. I mean, these are all prevention, cooking food well, wearing mosquito repellent. These are really all prevention behaviors. And I think we at the commission really focus on health education, on empowering our residents, and to your point, making sure that this information is available in different languages, that, that we're really going out to the community and providing these information. So I think it really is critical.
Okay. I'm going to troll the comments one more time to see if we have any questions before I let you go. We covered the vaccine, HIV and AIDS. We did give Pastor Marion where the vaccine came from and the companies. And I think, Dr. Sanchez, I think we're pretty good this morning. We're pretty good. Is there anything you would like to leave with us that we didn't cover that the commission wanted to make sure that the community is aware of?
Again, I think really just I hope that all families have a safe and healthy summer. We all need to be taking care of ourselves during these very difficult times, of our minds, of our bodies, and of our whole selves. And that includes all of the prevention, all of the prevention methods that we mentioned during this call, being up to date with your vaccines, and really just again taking care of oneself. So thank you.
And self-care, and that is the main thing.
Self-care is the way.
And you're taking care of yourself, Dr. Sanchez, with overseeing and seeing patients and staying up to date. Are you taking care of yourself?
I live by my own advice. So yes, I take my own advice. We try, right? I mean, but it's a reminder to all of us, to yourself as well. I mean, we're all doing important work, and and we all need to take care of ourselves. So
Absolutely.
I hope you are as well.
On that note, Dr. Sanchez, I just got a note from the producers that we got to end. So no, I'm just joking. Being here for me is a practice of self-care. So yes, I am. Yes, I am. Dr. Sanchez, thank you. And as you know, the platform is available. If you need to get anything out, have John or anyone get the information to me, and we'll make sure we get it out.
Thank you for having me. It's always a pleasure.
Thank you. Thank you. Bye-bye.
Bye.
Folks, that was our great Dr. Sanchez from the Boston Public Health Commission, who is also a practicing physician at the Massachusetts General Hospital. Thank you for tuning in today to an abbreviated episode of Your Healthy Java. We will be with you for Java with Jimmy tomorrow at 9 a.m. for We Need to Know Wednesdays. And I think I got everything covered. There is some other topics to which I would like to speak, but not during the Your Healthy Java segment. And so please tune in tomorrow at 9 a.m. To hear some commentary about a few things. And I think that's it for me. Pastor Marion, thank you. This is a real background. But with that being said, thank you all for tuning in this morning. Please share the information. Cindy Diggs, our kind of associate producer, is in the room. Good to see you, Cindy. Just wanted to acknowledge also the collaboration that Your Healthy Java did with Massachusetts General Hospital, our Department of Cultural Engagement, and also MGB and Urban Pride, the Boston Lesbian Gay Urban Foundation. We did a wonderful health summit on Saturday. Dr. Williams was there, who was our guest a couple of weeks ago, and it was remarkable. And one of the things that came out of it was that we need more conversations like that. And so just wanted to acknowledge Cindy that's in the room. Thank you all. Sharon Cornelius, there's a few things that I need to address, and I will address them tomorrow, but not during the, and presumably MGH probably may share some of my commentary, but maybe not the way it's presented. But with that being said, no, I'm messing. We will be back tomorrow morning and we'll talk about a few things. And thank you all for tuning in. And remember, if you reach out from now till the 14th, you may not be guaranteed to get a response. Emergencies and death, I told y'all, hit Mama Java, and she'll let me know. All right, that's it for me today. We will see you guys tomorrow morning. Well, you'll probably see me pop on live later. But we'll see you guys for Java with Jimmy tomorrow morning at 9 a.m. Have a wonderful day, everybody, and stay safe. Peace.